So we very often have both hyperinsulinemia and hypoglycemia. It is very important, if you're going to do any blood testing or have your veterinarian do any blood testing for horses or ponies that you think have EMS, that you do not do it when they're actively painful. Because if you take an acute laminitis for a number of reasons, whether it's Cushing's disease, retained fetal membranes in a mare, or acute GI disease with diarrhea, when the horse is actively painful, as a normal stress response, you will see high blood sugar and high insulin. So if you're screening a horse for this by laboratory blood testing, you want to do that blood sugar and insulin measurement when everything's quiet, when their feet are not painful, when they've recovered from the laminitic episode perhaps, if that's why you've sought veterinary attention. Don't do it when they're basically at their worst. It's tempting to do the testing then, but you can't really interpret it at that point. So ideally, you do the blood testing when their pain levels and their stress levels are low. There are some more fancy tests that you can use where you challenge them with glucose and insulin, which should only ever be done by a veterinarian, but they aren't that difficult to do and they're not dangerous for the horse. And again, if you do those at a time when the horse is sort of status quo in terms of its stress and pain levels, then they can provide almost instantaneously confirmation that that's the disease the horse has. There's probably, as I said, at least 4 or 5 university groups around in North America, and several in Europe too, that are looking at different ways of diagnosing the condition by doing different blood tests, different panels, different exams, and many of those are certainly sort of under the category of research at this point in time, and they're looking at various things that indicate abnormal fat metabolism, abnormal indicators of inflammation. But right here, right now, it's basically what they look like in terms of their body condition, whether or not they've had prior bouts of laminitis, and then confirmed during a period of quiescence with the blood sugar and insulin levels. And it doesn't really need to be more complicated than that. Not right now, anyway. As I mentioned, the biggest disease that is easy to confuse with EMS is Cushing's disease, because as many people I'm sure know, horses with Cushing's disease also are very prone to laminitis. And very often as veterinarians, one of the first triggers to us suspecting a horse may have Cushing's disease is because we're called to look at a horse that has acutely foundered. Cushing's disease horses tend to be older, they're mid to late teens and typically 20 and older. They have other physical exam findings which to us as a veterinarian really key us into Cushing's disease that EMS horses do not have. One of the keys being they have hirsutism, which means they have long hair coats that don't shed out in the spring and early summer. So if you've got a hirsute, which means a hairy horse or a hairy pony that doesn't shed out in the spring and going into the summer, then it is much more likely to be Cushingoid than to have EMS. If that horse is 22 years old and maybe is in body condition score 4 or 5, then again it's much more likely to be a Cushingoid horse. So a laminitic horse that has a moderate or low body condition score, that's middle-aged or older, much more likely to be Cushing's disease than the equine metabolic syndrome or equine metabolic disease. Very often the Cushingoid horses also have a history of drinking a lot and urinating a lot. They're what we call polydipsic and polyuric, which doesn't tend to be so much of a feature of equine metabolic syndrome horses. They very often have quite a lot of muscle atrophy. That's part of their disease. So they don't look as overconditioned or indeed anywhere near as obese as the equine metabolic syndrome horses. There are other forms of diagnostic testing that we use for Cushing's disease, but they too tend to have high blood sugars and high insulin levels. So that creates challenges to us as a veterinarian sometimes, teasing out those two diseases, and occasionally the two diseases can be present in the same animal, which is even more difficult to discern and take apart. But we have other tests that can help us confirm Cushing's disease, for which you will get a different result, a negative result if you like, if you run them on a horse with EMS. So, again, just to reiterate, they're younger horses with EMS, they're obese horses, or at least overconditioned and easy keepers with a high body condition score, and they have slightly different results to glucose challenge tests. So here's an example of 2 horses, one of which is a Cushing's disease horse and one of which is I should say, this is a former resident of ours from probably about 6, 7, 8 years ago now. So who thinks the one that he's holding is the Cushingoid horse? Okay, who thinks the one that he's holding is the equine metabolic syndrome horse. Excellent, excellent. So, long hair coat, you can see the grass just coming through the pavement. It's the beginning of spring. This horse hasn't shed out very much. If you look at his neck, he's not particularly cresty in any way, shape, or form. His body condition score is lower than this horse, although this horse is not terribly obese, but he's certainly well-fleshed, shall we say, and he shed out just effectively. That was an equine metabolic syndrome horse, that was a Cushingoid horse. They both had laminitis. Okay. So here are some other examples, which hopefully you can see in the back. So this is a classic phenotype, which means appearance of an equine metabolic syndrome horse. Okay? This is another equine metabolic syndrome horse. This is a Cushingoid horse, and this is one of those rare cases of both. This is a hirsute horse. If you look at it, compare the body condition to this one. This one's the classic Cushingoid older pony. Not what you call obese in any way, shape, or form. This hirsute, you see how much it's sweating? And fat. So the diseases can coexist in the same horse. Not very commonly, but on rare occasions you can get them both. All right, so I'm pretty much close to being up for time, so I'm just going to finish with spending probably about 5 minutes or so on treatment and management of it. Not that we unfortunately have a lot of good drugs to treat it with, and the emphasis is very much on husbandry and nutritional management rather than specific drugs to treat it. But there are some other speakers who are going to be coming up, but I'm going to stay till the end. And then if anybody had specific questions, feel free to come up and find me. I have a very selfish motive for saying that I shared with Dr. Cole. That is, I have 4 nephews and nieces visiting my house tonight, and they're all under the age of 7. And I forgot to tell my wife I was coming out tonight to this, so if you want to stay, I'll be here as long as you want. All right, so 4 equine metabolic syndrome horses. I would be delighted to stay here even if I didn't have nephews and nieces. Okay, so there's no specific drug therapy, unlike Cushing's disease. There's more than one drug that we use to treat Cushing's disease, but the majority of horses with it are treated with podolide. There is no single drug that is used to treat equine metabolic syndrome. We don't have a specific drug at this point in time that suddenly improves their glucose metabolism or really gets at their insulin resistance. We don't have a drug that really impacts that. There are some trials and some people interested in looking at some drugs like metformin and trilostane, which are essentially being borrowed from other species, in some cases from humans, where they are used to treat, for example, type 2 diabetics, in the case of some of these drugs like metformin. But at this point in time, they're largely unproven, although there are some research trials looking at them. You will find quite a few horses and ponies that are diagnosed as having EMS will go on some form of thyroid supplementation. Most commonly sodium levothyroxine as a way of trying to improve their insulin resistance and get them slightly better at using glucose effectively. So very often, a large pony, so let's say a pony really on the large end, or a regular-sized horse would be on about 50 milligrams a day. Some of them have signs of hyperthyroidism, so they become a little bit too active, but I don't actually frequently try and wean them off when they're on this. Very often when I talk to people about having them on thyroid medication for this, if they go on it and it seems to be helpful, it may well be a treatment for life. But I have colleagues who try to wean them off it once they've reached a target weight or a target body condition score, because very often, as we'll come over to nutritional management, what we're really trying to do is stop future episodes of laminitis and to get them in a thinner body condition.